Hello, everyone, and welcome to the Henry Schein webinar series on COVID-19. I'm Dr. Gary Severance with Henry Schein. And as usual, we're going to start out with Dr. Reznik and his clinical updates, and we'll follow that with a little update on extraoral suction devices. But first, Dr. Reznik.
Thank you, Dr. Severance. It's always a pleasure joining my colleagues and teammates as we work through this pandemic and get back to our normal or our new sense of normal. We have some exciting things to talk about today. If you've been watching the series or you've been following what's been coming out by different organizations like the American Dental Association or American Dental Hygiene Association, all with wonderful recommendations, or the CDC's recommendations or the mandates from OSHA, it's a lot of different documents. And I almost think we've done a webinar in each one. So we have something today to talk about that gets all of those recommendations and puts them into one document, and then it sources whose recommendations are what. And this is the OSAP and DentaQuest Partnership for Oral Health Advancement. It's best practices for infection control in dental clinics during the COVID-19 pandemic. So what this document does is what other documents have, and it really collates. It puts them all together, and it gives you some practice tips along the way. So you really have a document that the whole office can use and checklists that are involved with it. So let's get into it and talk about what we actually have here. So the team, first of all, I know most of the members of this team, and they're extraordinary individuals. I've already talked about Karen Gregory, the nurse. We have the leadership, the executive director, and Michelle Lee from OSAP. And then if you looked at the level of experts, you have dentists, dental assistants, consultants, dental hygienists, and of course the copy editor who has been with OSAP since I've known OSAP, Therese Long, who in many ways is a driving force still to this day on making sure that we provide the safest dental visit possible. So the first area I thought I'd look at is just preparing the clinics for patients and visitors, what you need to do. And these are things we've talked about. This shouldn't be very new, but the way they've organized it might make it easier for you to follow. So there's two major sections to this document: preparing the clinic prior to patient appointments, and then, of course, delivering safe patient care. So there's a yes and a no on or not applicable. So dental healthcare personnel really should look at all of the different items and put yes when they've completed their pre-office action item. And so you can literally keep track of what you need to do, have you done it, and who did it. And those are all wonderful additions. There's a source column that I've mentioned that where this guidance came from. Was it the CDC? Was it OSHA, the Occupation for Safety and Health Administration, the ADA, ADHA? When all is used, when they're all in agreement in the same source column, it means that everybody is offering the same guidance. And I think that's important too. So one thing is that this is a living document. So this isn't something that you print out and it's done at one point. There are going to be changes in the pandemic, and this document will reflect those changes as they go through. Just as the same way that the dental associations, hygiene associations, the CDC, they'll be altering their recommendations as we move through this pandemic. So one of the first areas I thought I'd go into a little bit more detail just to give you an idea what's in the document. I'm not covering the entire document today. We want to get to Dr. Severance's part of today's webinar, but I wanted to go through some of it just to give you an idea of what's included. So for policies and procedures, we have something where the CDC, OSHA, and the American Dental Hygiene Association all have the same recommendations. Universal source control, requiring everyone who enters the office, whether they're a patient, a visitor, or whether they have symptoms or not, to have an appropriate level of a mask. Patients and visitors are advised to bring in their own mask. We actually have additional masks at our program just in case they don't. So we provide them because we do have an adequate supply of level 1 masks at this point. Every employee will always wear a face mask when in the dental setting. I'm in my private office right now. The door is closed, which is why I don't have my face mask on. Cloth masks may be utilized by staff not involved in direct patient care. So that's fine. Clinical staff can use a cloth mask when not involved in direct patient care. So our clinical staff, if they're not involved in sterilization, they're not involved in patient care, they're just in the area, they can have a cloth mask on. But whenever you're doing work that revolves around creating an aerosol, you need that N95. If you're worried about splatter, the level 3, we've been through all of that. But this, again, is a review. It's going over what really makes this document special. Minimizing the number of people who accompany the patient is a recommendation from the CDC, the ADA, and the ADHA. So what's missing from here is OSHA. OSHA is more about mandates. So when you see the CDC, ADA, and ADHA, those are guidelines or recommendations on what would be necessary to provide the safest visit. You want to actively screen employees, patients, and visitors for fever. Every morning when I come to work, I get screened. We have a screener that comes for people entering the building, whether you're staff or a patient. And then to come into the dental program, I actually have an additional screener who goes through a list of questions. So not just the big 3 about dry cough, fever over 100.4, shortness of breath. We really go into some of the other symptoms that we've talked about, diarrhea, loss of taste, loss of smell, things that may have occurred in the last 3 days, or whether you've been exposed to someone from COVID-19, etc. Then if you look at the issue about screening patients, that's actually for all. So it's mandated by OSHA that we literally actively screen employees, patients, and visitors for fever. So that's what we're doing. A work exclusion policy is also included in this document. Something that we stress and stress and stress. If you are sick, you need to stay home because you don't know if you're running a fever, what the cause of that fever is. So, and it's very difficult, and I understand in the economic environment of today that it's difficult. I understand that people have limited time off, et cetera, but it really, truly is important. No matter if you're the dentist owner, dental assistant, front desk, dental hygienist, if you are sick, please stay home. You're protecting yourself and you're protecting your patients. So as I mentioned, we do a screening of our patients. We have a screening log. But what's really interesting about this document is they create in the addendum, there is a screening log that you can use. And so it really makes it easy. Not only does this document tell you what's necessary and what the guidelines are, but it gives you tools to use, and we'll get to that in a moment. If you have a healthcare worker in your clinic that develops a fever greater than 100 or other symptoms consistent with COVID-19, they need to keep their mask on and contact their physician and seek medical care, or their nurse practitioner or PA, whoever they are seeing. It's very important. If somebody starts feeling ill at work, check that person and make sure they have the appropriate care. Taking care of our staff and our team is of vital importance. So what was the rationale for some of these documents to come out? Well, the dental profession is categorized by OSHA as a very high risk category. We have discussed that. This assessment was due to the potential of an exposure to known suspected sources of SARS-CoV-2 during aerosol generating procedures, which include anything using the high and low speed handpiece, ultrasonic scalers, air water syringe at the same time, and air polishing. Remember, the last guidelines we went over said avoid using the high speed handpiece, avoid using the air water syringe, but it did say do not use the ultrasonic scaler. So what else do you do as far as communicating with your other team? I think that's important. We have huddle every day, and every day we are literally going over infection control concerns, patients that are coming in, how do we have the clinic running? I would say yesterday we had one of the busiest days in the clinic, and it was very successful. So we need to make sure that our employees are trained, they're updated on our new policies and procedures, and that you document this. A community, you should know what the community transmission is on whether you're at risk. I remember getting a question in one of these webinars that they had one case in this rural area since the beginning. What do you do? I still believe that I treat all patients as they are potentially carriers. We're seeing an uptick in the infections right now. We're at the beginning of summer. We have people that are in Florida going to the beaches. We have issues in Texas and Arizona, and California is jumping up. So literally, we have to keep an eye on our community transmission. If there's a surge in your area, you might literally want to avoid doing aerosol generating procedures. You want to make sure that you have enough PPE and infection control supplies. So that's something that we go over during a morning huddle. We talk about strategies for making sure that our patients stay socially distant. So how do we set up our waiting room? And if our waiting room is full, which is at this point very small, then we have overflow areas that we can keep our patients, or we can use that guideline to text patients when it's time for their appointment and they can sit in their car. All those different things that we have talked about. But communication with staff members is vital to having a successful program. You might want to assign people to specific duties. I have somebody who is assigned to make sure that the waiting area, the chairs, the doorknobs, all of those things are managed several times during the day. That is a person's responsibility, and there's a backup person. We want to use methods to minimize aerosol production in the office. I've even gone as far as getting some new cases so we can actually adjust partials and dentures. Not that I'm worried about an aerosol, but all of that acrylic dust or the material dust that would be on the floor in different areas actually is in a box now, a clear see-through box. So it's, again, another way of keeping the office clean. We want to make sure that you have a written respiratory protection program. What are you doing to make sure that your staff stays safe? And that is for all members of the staff. And then always encourage questions. People learn at different levels. People hear messages at different levels. So always allow for there to be questions and really enforce the idea that there is no such thing as a stupid question. So when you're preparing your dental clinic for patients and visitors, you have to have your policies and procedures, your preparation, make sure you have your equipment and supplies, you're adjusting your clinical areas to treat the new environment. You've already taken care of your entry and lobby. Remember, we moved all paper out of our lobby areas, our waiting room areas. We've ordered seamless chairs to make them cleaner, easier to wipe down, no carpet in the waiting rooms, those kinds of things. Making sure we do source control, and then patient visitor pre-appointment screening. We call up our patients and see, how are you doing? You feel fine, reminding of the patients, telling them that when they come in, things are going to be a little bit different than they were in the past, that they will be screened on entry to the building, they'll be screened on entry into the dental clinic. And then working on HVAC, which I've already talked is not my area of expertise, which is why you need to find somebody who is. And that's really important because an HVAC professional can literally determine strategies to reduce exposure to the virus. So as I mentioned, we am in the process of building a new clinic in the same building. And this is the first thing I brought up. What was our air exchange rate? We have to have the airflow going in the right direction. And since I'm blessed to work in a hospital, those issues were already taken into consideration. We want to increase filtration efficacy to the highest level compatible with your HVAC system. And this is a recommendation from the CDC and OSHA. Remember, OSHA can mandate. The ability to safely increase the percentage of outdoor air supplied through HVAC. That's through CDC. Appropriate use and placement of portable HEPA filters while the patient is actively undergoing and immediately after the procedure. And that is something that we're doing, especially for aerosol generating procedures. We are only doing limited, but yesterday we had some cases where we had to do surgical extractions. We weren't able to get them out non-surgically. So we made sure that we had the HEPA air filter in that that room and that HEPA air filter ran continuously afterwards. You can use upper room UV germicidal irradiation. That's another possible solution recommended by the CDC. And then limit the use of on-demand ventilation, such as leaving the fan running, including the bathroom exhaust fan. Remember, I mentioned this before. Keep that bathroom exhaust fan on during your work hours. And then we actually leave our HEPA filtration unit on overnight. The kinds of unit we have actually are helpful if we leave them overnight. And as far as the bathrooms go, we have facility staff that take care of that. So dental operatory specifics for patient care. So again, aerosol generating procedures need to be avoided whenever possible, and this is still the recommendation from all of the organizations. So this is a recommendation from OSHA, this is a recommendation from CDC, ADA, ADHA. And again, having all this information in one document is really remarkable because it does help us see what we have to do and what are recommendations and how we can make it safe for everyone. So to avoid these aerosol generating procedures, we want to prioritize hand instrumentation, avoid the use of handpieces, lasers, air water syringes, air polishing, ultrasonic, as we talked about before. Use rubber dams and high volume evacuation. We have high volume evacuation for the hygiene side, high volume evacuation for the dental side, and we're using rubber dams when we need to. And so I just that you have high volume evacuation for all members of the team, and we do have that. And then you can go through these checklists, and these are what I think is a wonderful addition that you can print and use. You have the patient triage questions, and these triage questions are complete. This is not just 3 questions, it's a complete list of questions, and very wonderfully well done. You have your respiratory protection plan checklist, your dental PPE donning and doffing, and please have your folks practice. Before we started any aerosolized procedures, we were wearing N95, we were putting on doffing and donning, because it's something that if you're not used to doing it in a certain way, you're used to doing something in your own different way, it's a training kind of thing. So you have to do repetition. And then, of course, your employee screening log that you want to keep track of, which is important. So that's it for what we have for this new document. As I said, it's a living document. It got all of the information from our major organizations, the American Dental Association, American Dental Hygiene Association, OSHA, and the CDC to really give us a guidance on how best to maintain the best infection control. So I'm very pleased that I was able to present some of that information for you today. Realize this is a long document. It's about 21 pages, so I didn't go over all of it for you, but it is comprehensive. So I hope you learned a few things today. Again, I really wanted to promote the OSAP DentaQuest best practices for infection control during this COVID-19 pandemic. It's a very useful document. I hope you take the time to download a copy of it. And with that, I'm going to turn over, as I normally do, the rest of today's webinar to Dr. Severance. Thank you.
Thank you, Dr. Reznik, as always, for your clinical updates. I just wanted to let everybody know that starting in July, we'll go to every other week with Dr. Reznik and his clinical updates. And now, as you remember from previous webinars, we covered a new category in dentistry, OPE, Office Protective Equipment. And in those programs, we outlined some air purification and air decontamination systems. Now we want to take it a step forward and go to extraoral suction devices. Okay, let's just review some of the things we've presented before on some of the previous webinars. And although we focus on the aerosols and not using aerosol or AGP aerosol generating procedures, aerosols are all around us when somebody sneezes, sings, or talks close together. So dentistry in general has done a great job of infection control and controlling the environment, but we know air management will be a new category to really look at again. And infection control is additive, so they talk about bundling and layering. And the 3 steps that EPA has said is source control, ventilation, and air cleaning. And it's up to each individual office, because every office in need is unique, to see what they want to add and how to control the air. First thing to start with is probably a HVAC engineer and look at the general airflow and then look for dead spots or areas where you can control. But as dental professionals, the source control is the most effective, using rubber dam, pre-procedural rinse just to reduce the microbial content, looking at the ventilation, and then air cleaning or air purification and decontamination. In a previous one, we got a lot of questions on it. In general, is a new system that's coming to the United States called Radicate, uses virus killer technology. And this combines air purification and air decontamination in one system. So just not recycling the air and eventually cleaning it, but in a single pass, it's essentially sterilizing or decontaminating. So to take it one step further, because there can be a little confusion, not many talk about the single air pass. But a lot of these systems, air filters, consumer issues, are put in a room with contaminants. The particle counts are made, and then a timer keeps track of it, and maybe 30 minutes later they go in and do a particle count as well. And the air keeps circulating and circulating. So at whatever time period they do, they come out and they get 99.97. A single air pass means with one pass of the air, they get a single air pass percentage of 99.9999%. So that's single air pass purification and decontamination because of the reaction chamber, photocatalytic oxidation, and they're one of the few that we've seen single air pass. So we're very excited about that coming in the United States as well, exclusive to Henry Schein. But what we want to review now is to share with you some of the extraoral suction devices that Henry Schein has vetted and is now offering. In general, different categories of equipment, but they generally do the same thing, either combining filters with UV light or photocatalytic oxidation, or just filters themselves. So interesting here when we look at this. And if you look back in dentistry and look at the research, a lot of people invested in this type when they had air abrasion units and or lasers, and they weren't doing four-handed dentistry. So some did exist in the past, but very few studies have been done. But if we look at this category, it's basically a hose coming through and then drawing air through HEPA filtration, MERV filtration, pre-filters, and then some also combine this with UV GI. If you look back at some of the studies, you can see that there is proof that a reduction in aerosols with air cleaning, essentially it's a reduction of colony forming units, not necessarily aerosols. This one study in 2010 looked at 3 different rooms and 4 different procedures. And what you need to do is, these are all different patients, so it's not necessarily comparative to each other, but in general, when you turn on one of these systems, this happened to be in 2010 an IQ Air FlexVac, and what they did was a cavity prep and measured the colony forming units, about 2 meters, I think, from the patient. And they saw when they did a cavity prep, the colony forming units reduced significantly in the first category in Clinic 1. In that same clinic, when they did a history and exam, which normally doesn't create aerosol, they got no significant difference. They moved to another room, another patient, so again, separate circumstance, and saw a reduction in colony forming units, and then in tooth extraction. Significant difference in tooth extraction, colony forming units. So using this has proven to take away some of the extraoral aerosol and the resultant colony forming units. And then the ADHA, Hygiene Association, came out with a comment in their most recent returning to work guidance, talking about high volume evacuators always being available in the hygiene rooms. And if you get back into ultrasonic scaling, maybe a dental hygiene assistant should be available. And that's maybe where these type of extraoral extraction devices may become most efficient and more valuable. Because when we look at this, and we've seen this before, but maybe not in this infographic, this ranks the annual salary versus the risk involved. Dentists, hygienists, and dental assistants are all on the far right of risk, with the highest risk being dental hygienists here and in other studies as well, using that same data from the Department of Labor. And so we know that if we can have a unit that pulls any extraoral aerosol away from the hygienist and away from the patient, it may be a benefit. What we don't know yet is any recirculation of that air. But also positioning of these units is very important. Even in CDC has recognized it for HEPA air filtration unit, which you could consider these to be in many respects. You need to position this unit to ensure that it does not pull air into or past the breathing zone of the dental healthcare professional. Now, Dr. Reznik spent some time going over a great resource by OSAP and DentaQuest, and that's the best practices for infection control in dental clinics during the COVID-19 pandemic, where it's a pretty extensive list and just came out last week. They've also included now weekly updates. Here's on a team huddle or weekly newsletters. In that document, they also provide information from OSHA on the risk or the hierarchy of controls with dental examples. So what they've done is the hierarchy of controls, and then they've added in dental examples. 1 through 5, what is the most effective? Well, the most effective is not to see the hazard at all. That's physically remove it, screen them, don't have them come in. 2 is replace the hazard. So even if they have the hazard, do teledentistry and others, the procedures. These are difficult to do if somebody has an emergency or needs restorative care. So then you take into effect, isolate people from the hazard, use the control, source control where it talks about rubber dam, change the way people work. If they're administrative, don't bring them back into the operatory areas. Create and train new employees in their roles of where to stay and where to stay out of. And if they're administrative, they essentially have low risk and don't come in contact with the patients. And finally, obviously, if we do see the patients and we do have to do procedures with patients and dental assistants, dentists, hygienists, protect the worker from the hazard. So that's gowns, gloves, PPE, mask, face shields, goggles, and N95 respirators. Now, Henry Schein does offer some solutions. There is more demand than supply, so there is a delay for these. And I just wanted to go over a few so you can get a little inside look of what these systems do. Again, it's a device that has typically a tube that can be positioned near and away from dental healthcare professionals and away from the patient's mouth. It does need to be properly placed. And what it does is draw air in, pretty much dry air, but a lot of them have a filter to keep the moisture out. Then through a HEPA filter, in this case, there is also UVGI or ultraviolet germicidal irradiation, and that vapor filtration. Significant airflow, so it can draw in. Sound is below 60 decibels. It has adjustable speed, so it can also, when you're not using it extraorally, you can use it as an air purifier, can continuously draw air in and out. And some have casters, so you can roll them for different operatory, and when they do that, weight isn't an issue. That's the extraoral suction system by ADS. A second one that also combines UVGI and a pre-filter, a HEPA filter, and a carbon filter for the odors and VOCs or volatile organic compounds. With a higher speed, a motor that draws in air, and a dome effect. And I know several organizations are looking at this and doing some evaluation on it, and sounds very promising. Again, you can use wireless or wired remote from any of these systems. This one does not have casters on it, but as you can see, it's low weight and can be carried easily with the handles. That's the Aegis Aerosol Vac Station by the Chow Group. And then one that's been a long-standing partner with Henry Schein in the laboratory has adapted their systems now to bring in Chairside. That uses a tube to place over near the patient, a 6-foot flexible hose, HEPA filter, particle filter bag, and you can add a carbon filter. A good CFM airflow there, adjustable speeds, and with casters, and an optional foot pedal. And then finally, another company that's worked with Henry Schein for a long time, Quattro. They offer 2 versions of this based upon primarily the hose there and the bag that's enclosed there, HEPA filter, a MERV filter, and a chemical filter. There's a filter bag that can be sealed, digital controls, a smaller arm area that can rotate 360 degrees, and different alarms when things need to change. So it's generally a pretty succinct group of products to choose from. But most importantly, many of these didn't exist just a few months ago. So we continue to look at research coming out. So we do know Dr. Rella Christensen has started looking at these along with air filters for Sierra Report. And she's reported that starting in August 2020, she'll have as comprehensive as she can, but can be continuing this throughout the year quarterly with updates on air filtration, extraoral evacuation. Dr. Wally Renee doing wonderful things in all phases of digital dentistry and now into air management, is checking out these systems very uniquely. He's at the Medical University of South Carolina, and many of you that follow social media may know of him, but his group does amazing work. And then we understand the dental advisor is also looking at air management and extraoral devices. So it's safe to say that over the next few months, different reviews of these, when these products become available, will be coming out and giving additional guidance to these. And again, I just want to emphasize every office is different. You need to look at your space, meet with an HVAC engineer and look at your general air control, and then decide how you can implement source control, if you need to increase ventilation, if you need to put extra MERV filters or higher MERV filters without constricting the air in your HVAC system. And then in enclosed spaces or areas that can be controlled a little bit, look at about portable air cleaning, the same with the extraoral suction devices. So anything you do is better, it just comes to a point of diminishing return, but it's up to you. And finally, I like to end on a good note. Another study came out just recently by MIT. It was reported by Fast Company, but they kind of, or they did list, what you should do because it is worth the risk, what shouldn't you do because it's not worth the risk in different environments and where you should go. And it based on 26 types of businesses. And what's very nice is dentistry continues to be a do-it, probably worth the risk. Banks, even colleges and universities. And what they say is skip it is gyms, cafes, juice bars, sporting goods stores, liquor and tobacco stores. So get those delivered, don't go to the stores. But anyway, it continues to say a public trust and importance of dentistry. So that's always a very good point. So that's the extraoral suction devices. And just another reminder, starting in July, we'll go to every other week or bi-weekly updates with Dr. Reznik. Those are Fridays at 2 p.m. Eastern Time, July 10th and July 24th. To register for those, you can go to https://henryscheindigital.com/COVID-19-webinar. And as always, if you have any questions, concerns, or topics for future episodes, please let us know by emailing us at webinars@henryschein.com. And please subscribe to our Henry Schein YouTube page to get the latest notifications. Until we see you again, have a wonderful, happy 4th of July. And as always, stay safe and stay informed.